Hello everyone, I'm Dr. Nahla Hamouda, lecturer of clinical pharmacology in the College of Pharmacy, Rizmikan University. Today, I'm going to talk about a very interesting and so important topic for you as a pharmacist is the pharmacology in pregnancy. If you truly understand the output of this lecture, I think you can prevent many adverse effects and you can protect the life of the newborns. Let's start our lecture, and it has two parts, so please follow on part 2. So, as a pharmacist, before prescribing any drug to a female patient, you have to ask her, are you pregnant or expecting pregnancy? Or are you a lactating mother? I know it's somehow embarrassing in Japan to ask a lady in the pharmacy, are you pregnant or not? But in medicine, there is nothing to do with being shy. Please, whenever you are a pharmacist, boy or girl, please ask the female patient, are you married? Are you expecting pregnancy? Are you pregnant? Do you have a baby and you are breastfeeding it? Please ask always this question to any female patient, because if she is pregnant and it's still in the early first month and you give a wrong drug which should not be given to a pregnant female, she will have a diseased baby 100%. So please protect the newborns. So this is one of the most important points I want you to stress. Always ask your female patient about her marital status, whether she is expecting a pregnancy, even she wants to get pregnant soon, or if she is lactating or breastfeeding her child. So today I want to describe about the pharmacotherapy in pregnancy. First, we have to understand what is pregnancy. Of course, everyone knows what is pregnancy, but we want to describe it in a medical and pharmacological terms so we understand how, as a pharmacist, pregnancy means to us. Pregnancy, it's the time from fertilization or conception till the fetus is born, which is called the delivery. Times of fertilization, it is when the ova and the sperm, they become one cell and they unite together to form the zygote. This is conception. From this day, the pregnancy starts. As you all know, this one cell continues to divide till it forms a small baby. During these stages, the baby's body is growing and making new organs. The heart, the brain, the GIT, all organs are made during this very early time. That is why, as a pharmacist, we should know whether this female is pregnant or not. The full duration of pregnancy is 40 weeks. And we say the baby who is delivered at 40 weeks, it's called full-term baby. It means this is the actual and most effective time for pregnancy. The 9 months pregnancy for us as a medical team is divided into 3 trimesters. What is the meaning of trimester? It means 3 months. So it is divided into 3 months times. So we have the first trimester, which is the first 3 months inside the uterus, the second trimester, and the third trimester. These are the medical or a pharmacological description of the pregnant female. So to make the things more clearly, I want to describe how we say about the child inside his mother's uterus. So the age in weeks is called the gestation age. So we divide the gestation according to time. So we have the first trimester, as we said, it's the first 3 weeks, and simply it's from conception till the 12th week of pregnancy. And then we have the second trimester from the 16th to 24th week. And then we have the third trimester from the 25th, around the 25th week to the 38 weeks. If the baby is delivered before 38 weeks, we call it a preterm baby. And a full-term baby is actually the baby born from 38 to 40 weeks of pregnancy. So this is a full-term healthy baby. And they don't need to be put in a emergency unit or intensive care unit for the newborns. They are totally normal. Sometimes when they are born preterm, before 38 weeks, they need to be incubated in the neonatal intensive care unit. So another important information we need to know is about the organ which is only present in the female body during pregnancy. It is the placenta. Of course, many of you know the placenta. What is the placenta? It's an organ that develops in the uterus during pregnancy. This structure provides oxygen and the nutrients to your growing baby and removes the waste products from the baby's blood. The placenta is the connection, simply the connection between the blood of the mother and the blood of the baby, and so they can exchange all the oxygen and the nutrients coming from the mother going to the baby, and all the waste products like the ammonia or carbon dioxide coming from the baby and going to the mother to be excreted outside her body. So simply, the placenta is the life-carrying organ for the baby. The placenta in its structure has what is called the placental barrier. Barrier, it means some kind of tissue between two parts. In our body, we have the blood-brain barrier, which is the barrier between our brain and blood. And in the fetus, there is the placental barrier. But this barrier is not a perfect barrier. It means it doesn't prevent 100% of drugs crossing from the mother to the baby. Some drugs can unfortunately cross the placenta and goes to the growing baby and can affect his development. So to have a full picture about pregnancy, not only related to the placenta, but I wanted to describe the physiological changes in the pharmacokinetics in pregnancy. As I mentioned before, pharmacokinetics is the trip of the drug inside the human body. So it has four components: the absorption, the metabolism, the distribution, and the excretion. All these parameters are affected by pregnancy, and in the pregnant woman, these parameters are changed. What happens in these parameters during pregnancy? First, regarding drug absorption, which is the absorption of the drug through our intestine into our blood, there is a slowing down of the gastric motility and so the drug absorption. The intestinal tract in our body or in the pregnant female is moving very slowly. So the drug absorption rate is changed. Pregnant women always have that nausea and vomiting, especially early in pregnancy. So sometimes they cannot even drink or any water. And also they cannot eat. So if we are giving an oral drug through the mouth, sometimes the pregnant woman cannot take it. What happens in the drug metabolism? There is increase in hepatic metabolism. It means the rate of breakdown of the drug molecules in the liver is faster, especially the lipid-soluble drugs. So the amount of free molecules available for drug action will be less, so the drug effect will be less. Drug distribution. Always the pregnant woman has excess water in her body. So this increases the blood volume. So for example, if we have 5 liters normally in our blood, maybe it's 5.5 or 6, and this the much fluid inside the body can lead to much water where the blood is distributed. Also, there is a decrease in protein binding with increase in passage of drugs through placenta. In our body, the drug is always carried on a carrier protein that carries the drug to its target site. What happens if this carrier protein is not there? Then the drug molecule is alone in the blood, so it's free, so it can go anywhere. So sometimes, eventually, they cross the placenta. And lastly, about drug excretion, the kidney activity excretion greatly increased. So a lot of drug, more than usual, is washed out outside the body, so its effect in the body can decrease. All of these actions are due to presence of the hormone which increased to very high level during pregnancy, which is the progesterone hormone. This hormone is the key hormone for pregnancy because this hormone increases to a very high level in pregnancy, so we have all these physiological changes in the pregnant woman. So, what are the factors that affect the placental drug transfer? I mean, what determines or who can say that this drug can pass through subplacenta or not? It's according to many factors. We are going to list some of them. First, the physiochemical properties of the drug. It means the drug molecule itself, whether it's a small one, it's a big one, it's acidic one, it's alkaline one. All these chemical properties can affect the passage of the drugs through the placenta. For example, large molecule drugs, of course, they cannot cross through the placenta, but the small drugs can cross. The rate at which drug crosses the placenta and amount of the drug reaching the fetus. It means whether there is high amount of the drug in the female blood, in his mother blood, and how much dose she is taking. So, if the number of drug molecules is very high in the mother's drug, of course, more drug can cross to the placenta to the fetus. The duration of exposure to the drug. It means how long his mother is taking this drug. It's only for 3 days, 1 month, 3 months, 1 year. So this is the duration of exposure. If the mother is taking the drug for a long time, of course, some of the drug will affect the fetus. The distribution characteristics in different fetal tissues. It means, for example, the fatty or lipid-soluble drugs, they like to go to the lipid organs. What is the most famous lipid-rich organ in our body is the brain. So some drugs, they like to go to the fetus brain. Some drugs like to go to the liver. So the main side effect will be in the central nervous system of the baby or the liver of the baby. The stage of placental and fetal development and the time of exposure of the drug. As I mentioned before, I divided the pregnancy into 3 trimesters, the first, the second, and third. I want you to remember that the first trimester, it's between from time of conception till 12 weeks. It's the most dangerous time because the fetus is still developing. All his organs are performed during this time, and the rate of exchange and the percent the drug can reach the fetus is very high. And lastly, the effect of drugs used in combination. Sometimes one drug alone cannot cross the placenta, but if it's combined by other drugs, they have more interaction, and unfortunately, they can both pass to the fetus. So drug interaction is also important. Why we are not trying to know all these factors? Because all these factors affect what is called the teratogenic agents. What is a teratogenic agent? It is the element which can cross to the fetus and cause abnormalities in his body and his development. It means after delivery We don't have a normal baby with a normal development and physiological functions of all organs. We have a defective baby. He is not normal. He can has the effect all through his life. So this is enough for lecture number 1. Please follow for lecture number 2 to understand what are the teratogenic agents which are important for us as a pharmacist to instruct our patient during pregnancy. Thank you.